Hi and welcome back to another video of Medic Notes. This video will be on bronchodilator technique. So the indications to use a bronchodilator is bronchial asthma, chronic lung disease, and hyperactive airway disease. The equipment that are included in bronchodilators are inhaler device such as MDI, which is metered dose inhaler, or another type is the Easyhaler. And another equipment is spacer with mask. This is used especially for children. So first I'll talk on the technique to use metered dose inhaler using spacer with mask. So this picture shows the mask, the spacer, and this green item here is the metered dose inhaler where the medications are inside. So the procedure, the technique to use: first, remove the MDI cap, shake the inhaler for 3 to 5 times in an up-down motion. Place the MDI into the end of the spacer. Breathe out gently as long as the patient feels comfortable. Then apply the mask over patient's nose and mouth. Make sure that there is a good seal so no medicine will escape. Press the MDI canister once at beginning of normal breath. Ask the patient to breathe in slowly and steadily through the mask. Next, ask them to count 1 until 10 slowly in their head. And we can help them by saying 1, 2, 3, and so on to get the right timing. This is done while holding the spacer with the mask firmly onto the patient's face. Next, wait for 30 seconds to 1 minute before repeating if the patient needs subsequent dose. So if they need another dose, remove the inhaler, shake it, and repeat the steps above. So that is the technique for MDI using spacer with mask. Next, I'll talk on another type of bronchodilator, which is using the Easyhaler. This is a picture showing the Easyhaler, which is another type of inhaler. So the technique: first, insert the powder inhaler into the protective cover. Then remove the dust cap. Shake the device before using, and then hold it in upright position. Press the device only once between the thumb and the forefinger until we hear a click sound. Keep holding it in upright position. Breathe out normally, away from the mouthpiece first, and then when the patient is ready, we place the mouthpiece between their lips and close the lips tightly around the mouthpiece. So ask them to breathe in deeply through the mouth only. And then remove the inhaler from the mouth. Hold their breath for 5 to 10 seconds. And next, if they need another 1 dose or more doses, repeat steps 2 to 10. After that, put the dust cap back on the mouthpiece. And remember to store the Easyhaler in a dry place. So proper maintenance include cleaning the mouthpiece with a dry clean cloth. Never use water or any other fluid when cleaning the mouthpiece. And the inhalation powder should not be exposed to humidity. So if the powder becomes damp, it is not suitable for use and should be disposed. That's all for this video. Thank you.